Welcome to Oz Arab Media. It's Shay, and today we're having a very important conversation with two doctors, Australian-based doctors in Perth, Dr. Mareed and Dr. David. Thank you so much for joining us today.
Thanks, Shay. It's great to be here.
Thanks, Shay. Lovely to chat.
The pleasure is ours. Now, the humanitarian crisis has only worsened in Gaza, so today's conversation is more critical than ever. Before we get into our first question, if you could share with our viewers the work that you've done and the impact that it's had already for the people in Gaza.
So Shay, we've started a charity group called Perth Doctors Medical Aid for Palestine over a year ago. We, I guess, began, like most people, feeling completely powerless and helpless to do anything about this massive catastrophe for the people in Gaza. So we started fundraising. We've raised over $100,000. We've made sure to focus on working with charities that we're personally connected with, who are on the ground in Gaza, delivering humanitarian and medical aid, particularly to vulnerable children and their families. And we've also tried, as doctors, we believe it's really important for us to speak up for our colleagues around the world, wherever they may be. And as you know, many healthcare workers, doctors like us, have been abducted and illegally taken while at work, even in the operating theatre, and have been detained illegally for over a year. So as doctors, we're ethically obliged to speak up on behalf of our colleagues wherever in the world they may be.
Dr. David, did you have anything further to add to that point?
I actually don't. I think Mairead has covered that very well. And essentially, I've been on this journey with her since last year. And I've been really impressed by the generosity of people and their involvement in our cause.
Thank you for sharing. For our first question that I know a lot of viewers are very keen on hearing, the debate on Gaza has extended beyond the traditional political sphere. It's become part of everyday life. You see conversations happening within education, healthcare, and cultural organizations. In your view, what makes this conflict different than the previous ones, and why is it so important to be driving this conversation on a national level?
Look, I think it's become very complicated over the last 15 months or so. I think many people were shocked by what happened on October 7. And with healthcare workers and with my colleagues and peers, there seems to be a relative ignorance around the journey for the Palestinians up until October 7th. And everybody has, to some extent, been focused on the events of that day. And I think when we witnessed the response by Israel to the attack by Hamas on the day, which I obviously don't condone, but the witnessing the response of Israel has, I think, shaken a lot of us up, in the sense that many of us considered it disproportionate. And as time has gone by, it's become even harder to accept, especially the indiscriminate bombing of hospitals and universities and schools and camps. And from a healthcare worker perspective, we've taken it very personally that hospitals and our colleagues haven't been protected. Now, that aspect of this conflict has crept into our social circle, it's crept into our hospitals, and because of different agendas and different cultural groups, it's become quite tense at times and been a rather tricky process to navigate. And what we have been doing is trying to inform as well as provide assistance and support for a lot of the innocent civilians on the ground. As part of that, we've been trying to some extent educate people that normally weren't that tuned in to the Middle East conflict. We've been trying to educate them along the way and do as much as we can, essentially for the children and the innocent civilians involved in this conflict.
Thank you for sharing, Dr. David. Dr. Murray, do you have anything further to add? We've touched on it already. Your role as a healthcare professional, how does that role influence your perspective on what's going on with the conflict, but also its broader implications?
Well, I mean, for me, both David and I are parents of 4 children. We're both specialist anaesthetists. I'm a pediatric anaesthetist, and David's an adult and pediatric anaesthetist. And to hear stories from colleagues and doctors who are working in Gaza telling us about little children having to have surgery with no anesthetic, having limbs amputated with no anesthesia, mothers having cesarean sections with no pain relief, patients being intubated, getting a breathing tube down to go on a life support machine with no sedation. For us as anaesthetists, we spend our lives keeping our patients comfortable, making sure they wake up pain-free and have the best possible outcomes for surgery. So to hear that that is happening to patients, we just cannot imagine the trauma that those poor people are going through. You know, it's so real to me every day when I anesthetize a little child, take them from their parents' arms and give them the best anesthetic and ensure they wake up completely pain-free from whatever surgery they're having. And it just brings to mind the absolute catastrophic trauma that those poor people, I cannot imagine a child having a leg amputated with no pain relief. And one of our colleagues, Dr. Mo Mustafa, is in Gaza currently. And since the resumption of bombing on the 18th of March, he's just describing utter hell there. No pain relief, no sedation, no nothing to help patients. And it's not just patients being brought in dying, but so many of them are succumbing to injuries that would be completely treatable if there was a proper healthcare system, if the healthcare system hadn't been completely destroyed, you know, if patients had access to antibiotics. I mean, he told us sometimes the only thing they can do is give children clean clothes. And that even that little thing, it's so bad there that that little thing is making a massive difference because they're getting skin infections and all kinds of issues from, you know, wearing filthy, dirty clothes that haven't been changed in months and months and months. So, yeah, as healthcare workers, you know, we're struggling with what's happening over there, especially when we work in Australia and we have such an amazing healthcare system here and such fantastic outcomes for all of our patients. Every patient deserves that. Every child deserves that, regardless of where they are in the world.
Again, a very important conversation to be having. We speak a lot in the policy world about obtaining the expert evidence from people on the ground and as well from medical and healthcare professionals, so that this conversation has really helped shed light onto other areas of the debate that perhaps our leaders should be focusing on. Again, if you're looking at the role of a healthcare professional right now, how would you best describe their role, not only in the healthcare space and settings in Gaza, but also in peacekeeping efforts?
Do you want me to go?
Yeah.
I just want to emphasize before we get on to that question that there is an incredible moral injury component to healthcare workers on the ground in Gaza, as well as healthcare workers here in Perth and around this country and probably all over the world. First of all, the people in Gaza, I can't possibly imagine what it must feel like to be on the ground and have skills and knowledge that are potentially life-saving and not being able to use them. Some of the videos, some of the videos that Mohammed Mustaf has been sending back, I have found absolutely shocking. And I can tell you that I have seen a lot of trauma over 30 years of clinical experience. And even I have been shaken to the core with some of the videos that I've witnessed. And I think healthcare workers being stuck on the ground, not being able to give what is needed for surgical procedures, for amputations, for burns treatment, for shrapnel wounds. I mean, there is one scene that I've witnessed of actually a family ventilating their own child because of a lack of mechanical resources and ventilators and machines. So you have parents squeezing the bag to breathe their unconscious child. I can't possibly imagine the trauma involved in doing that. So, I think it's important to realize that there are primary victims, secondary victims, and there are tertiary victims, in the sense that there are many compassionate healthcare workers around the world that are anguished, enraged, and frustrated because they know that it doesn't need to be that way. And with indiscriminate bombing and the ongoing killing of civilians, it's really hard to truly appreciate that this is the place that we've reached in this world. It's unfathomable.
Dr. Mairead, was there anything further you'd like to add? Dr. David has gone into a lot of detail and shed light on the extreme circumstances in Gaza.
Look, you asked about peacekeeping and our role as healthcare workers. I mean, what we have also tried to do, as well as fundraising and speaking out on behalf of healthcare workers in Gaza, we've tried to advocate for the Palestinian people. And really, we found a lot of the issues here aren't being covered in the mainstream media. People aren't aware of what's happening. Like David said earlier, many people think this all began on October the 7th, which was, an absolutely calamitous, evil act that cannot be condoned. But there is a history that goes before that. So we have spent a lot of time trying to educate our community by putting on screenings of films. We've screened a documentary called Where the Olive Trees Weep. You may be aware of it. It was filmed in 2022 in the occupied West Bank. And we've shown that to over 500 people in Perth, to absolutely fantastic feedback. So many people who saw that film had said to me, I had no idea that Palestinians' lives were like that, or this has completely reframed how I think about this issue. So really, as doctors, I believe we've got a role. For peacekeeping, you have to listen to both sides of any story. Everybody has to listen to each other, or there'll never be resolution. So for us, we're trying to educate our community, show films to raise awareness in our community about the Palestinian narrative, because really in our around where we live and our work, that narrative and those stories have not been heard, and they need to be heard as well, or we will never, find a path to peace.
Yeah, you've done a lot of work, not just overseas, but supporting that greater education and awareness piece within Australia and Perth. If you could walk us through now your approach to fundraising and charity efforts for the people in Gaza, what does that include? And how have you worked with the broader community groups here, including with your Jewish colleagues, to support greater efforts and medical supplies in Gaza?
So I'd like to hand that over to the boss on my left here, because she's done a fantastic job of actually leading the way here. So I'll let Mairead answer that.
Well, I'd first like to start that, we started out as 5 people sitting around my kitchen table, feeling helpless and powerless, not connected personally to anybody in Gaza or any other groups. And I just wanted to make the point that anybody feeling helpless and powerless, you start out so small, you might feel alone, but actually, as you go through things and on the journey, you connect with amazing people other groups, and it leads to something much, much bigger. So we've collaborated with Jews for Palestine WA, healthcare workers for Palestine WA. We knew none of these people a year ago. It's been an amazing journey that we've been on. We've connected with Fiona Stanley, the former Australian of the Year, who's helping us and supporting us. Dr. Tim Keenan, a retired Perth orthopedic surgeon who spent the past 20 years working as a humanitarian all over the world, but particularly in Palestine. He's over 80 years old and he's just returned from a mission with David in the West Bank. One of the films we screened, Israelism, a documentary, we collaborated with Jews for Palestine WA on that. You know, it's really important that both stories are heard and both groups work together. We've held quiz nights. We're actually having another quiz night tonight on the 22nd of March, and we've got an auction. We are just absolutely blown away and overwhelmed by the support of our local community, our friends, local artists, local businesses in the Perth area who've donated amazing items for our auction. So we should be able to raise, you know, thousands and thousands more dollars. We've also become connected. We started out, again, not knowing charities who are on the ground in Gaza, but through the journey, we've actually connected with people that we know and trust who are working in Gaza. So particularly, we're working with Children Not Numbers. It's a British NGO that was set up about a year ago. It's run by pediatricians from the UK and Ireland, but there's no foreign doctors on the ground in Gaza. They employ local doctors, local specialists. They've just opened a school that has enrolled 400 children. They're currently treating children with leukemia in Gaza. We sent them $25,000 over the past couple of months to buy clothes and warm blankets for children with chronic medical conditions and all of their families. As some of your listeners may be aware, you know, a couple of months ago when it was really cold and wet, at least 8 newborn babies died from the cold. I mean, that is just unimaginable. A little baby comes into the world loved by their parents, and only a few days old succumb to the cold because they've been forced to live in a makeshift tent made out of sheets, and it's pouring rain. And I just can't comprehend the cruelty and the inhumanity and the lack of compassion. And I just wish the Western media would share some of these stories, because every child's life mattered. You know, every one of these children is loved and mourned and deserved to have a future. So, yeah, we've just got to keep going, advocating, educating, and to be honest, we've connected with more and more like-minded people. I believe that we're growing all the time, and we're learning every day. We're both reading more and more about the history of Palestine. We're connecting with more and more Palestinian people. We're trying to now support some families who have arrived in Perth from Palestine. And it's just very important that their stories are heard.
Thank you. You've touched on very emotional topics, and I can see emotion behind these stories. And for anyone out there, we encourage very respectful conversations and debates on the subject. And for our colleagues in the media industry, you know, both these doctors have come in today to talk about what's going on in Gaza for the people and families in Gaza. So we hope that this conversation extends and fosters greater discussion for sure. You've touched on it a little bit already, but what would be your advice to those feeling helpless and feeling as though it's gotten out of hand and they're watching things unfold in the news? What would be your advice to them?
Well, it's very hard to give advice in this situation because their feelings are legitimate and very real. And I think we've all felt distraught is probably the word, and anguished this week with the inevitable breakdown of the ceasefire and the sheer numbers of deaths in a very short period of time. Look, my only advice is to, I don't know what the professional therapist would say, but number one would be to limit your exposure so that you're not overwhelmed to a lot of the uh, news and items coming through. But secondly, to maybe connect with other like-minded people, debrief together, and perhaps consider what you can do in your own backyard in some small way that contributes to supporting efforts of perhaps bigger organizations in Gaza and the West Bank and Palestinian territories. But by taking small steps, it helps reduce the sense of powerlessness, I think, for a lot of individuals. And it's certainly helped us being involved and connecting with other groups and knowing that there are there is humanity out there, and you just have to connect to it to understand that you're not alone in thinking that it's a crazy, cruel world, and that other people are taking steps to help support and benefit those victims of what is an extraordinarily cruel and brutal campaign.
Yeah, I think connecting with like-minded people and reaching out, connect with us. We'd love more and more people to follow us, connect with us, and support us, because there's been a lot of fear about speaking out, particularly, in healthcare, particularly doctors, I think, like us and people that we work with. Many of them are supportive but don't speak out. There is a lot of compassionate people out there. There's a lot of support. So many people are overwhelmed and devastated by all of it. How could you not be, as a human being, as a parent, as a doctor, as someone with a shred of compassion for your fellow man? One of my colleagues from Ireland, he's currently in Gaza, a trauma surgeon. He said the other night, at least, 40% of the people being brought in dead were children. That is just this indiscriminate killing of little innocent children. It's just heartbreaking. And any human with, a heart and a soul, it's very hard to comprehend that that is being accepted by people in power and those who have the power to change it. So, like David said, just reaching out to like-minded people, write to your MP, write to your foreign minister, write to the prime minister. I mean, the more and more people that join demonstrations, just it will be a collective effort, I think, on behalf of just normal people that are going to eventually make this stop, because the people in power are not doing that. They're not, standing up for what's right and what's just. And this is not just this what is happening.
Very well articulated. And from everyone here at Oz Arab Media, we want to thank you, not just for your work, but for your continued work for Gaza and people and children. We are very fortunate to be here in Australia, so there are avenues to connect with like-minded people, to reach out to your elected leaders, and we support continued conversation on the debate. For all our viewers, please reach out to these two amazing doctors who will be supporting. We will be sharing their charity links further. And from everyone here at the Oz Arab Media team, I just want to say thank you. Stay connected with both of these doctors. Did you have any words to share with our viewers before we suggest and recommend that they contact you after this conversation?
Yeah, look, I just want to say that that don't despair, that there are people out there that feel the same as your viewers do, and that there are organizations trying to make a difference. And we need to maintain a little bit of the anger and a little bit of the rage to stay motivated and to affect change. And I think that with more and more people connecting and more people speaking out and not being afraid to speak out, because there does come a time where you have to cross that threshold and declare your cards. That with more and more people not being afraid to speak out, perhaps we can apply some pressure to some of those leaders around the world that are making decisions that we can't quite comprehend.
Yeah, we must never ever let this become normalized. You know, that for me is the most important thing. This is not normal. This should never be accepted, the indiscriminate children killing of innocent civilians. Um, so just reach out. You know, the more people we can connect with, the more support we can get, the more that we're going to be able to do to help people in Gaza.
A
And
very
thank you
serious,
for having us.
No, it's a privilege from us here. It's a very serious and important conversation to be having, especially with the ceasefire now over. Like I said, we encourage people to continue the conversation, our audience, with these two amazing doctors, and from everyone here at Oz Arab Media. Stay connected and stay engaged. There'll be more to come.